Oh, hello, ma'am. Good morning. Such a great day to meet you.
Hello, ma'am. Yeah, it's one of a good day for meeting you here.
Okay. So before we talk to each other, let me introduce myself, ma'am. My name is Midwife Ziyan. I am midwife in charge in this morning shift. Could we knowing each other first, ma'am, before getting into deeper?
Oh, yeah. Hi, ma'am. My name is Dea. I am 25 years old.
Okay, ma'am. So may I help you, ma'am?
Yes, ma'am. I'm coming here because I feel sick, like feeling not well. I feel tired and vomiting all day long, especially in the morning. And I don't have any menstruation schedule since 1 month ago. I feel like always want to throw up and feel so dizzy. I barely eat any food lately, and what I eat is always swap, and I feel like I don't want to eat. It is worse, especially in the morning.
Oh, okay, ma'am. So from what we have learned about your symptoms, that's what we call is morning sickness. It's a common thing that happens during the first trimester of pregnancy. And sorry, before we have getting into talk about it, I shall asking about your relationship status, ma'am. Did you have married yet?
Yes, ma'am. I was married since 1 year ago.
Oh, okay. It was 1 year, yeah. So how long you feel your body have different like this?
I have feeling it around 2 weeks ago, and I have checked with test pregnancy in the morning, and the result is 2 of having seen a positive word on this test spectrum.
Oh, okay. So this is your test pack. Oh, okay. The result is two or positive, yes, ma'am. So I should ask you about your last menstruation, especially the first day of the end of your last menstruation. Did you remember it?
Yeah, I remember and wrote it on my calendar. My last menstruation is 20 January 2020. I have cycle of menstruation around 7 days till it clear or no spot.
Okay, so it was clear, okay, ma'am. So you are such a detailed person, ma'am. So good for you. So okay, from your symptoms, it say it your pregnancy, but it would be better if we could check it more detail with ultrasonography, or we call it as USG, ma'am. So before we check about it, based on the calculation of your menstruation, the gestation period has entered at the age of 8 weeks or 2 months old. So I have to asking a few questions to complete your identity on our record of health in pregnancy. Okay, ma'am?
Oh, yes, okay, ma'am.
Okay. So what's your husband name, ma'am? And when his birth of that?
His name is Danny. His birth of that is to February 1993.
Oh, okay, ma'am. So where do you live or the address of your home?
I'm living in our own house in Kementerian Street number 23.
Oh, I think I know. It's been around 50 minutes from here, right, ma'am? Nearly to
Oh,
Compound Traditional Market.
yes, that's
Is it
right,
right?
ma'am. Right.
Oh, okay, ma'am. So I will continue about the question. So what's your and your husband profession, ma'am?
I'm not working, ma'am. Just stay at home. But my husband is manager on exporting for logistics.
Okay. So what you and your husband last education?
My last education was bachelor degree, and my husband some education with me.
Okay, ma'am. So what is your phone number, ma'am? Do you remember it? Can
Oh,
you
yeah,
spell it?
yeah. My phone number is 0811345678901.
Okay. So I will check about the complication or health status of your family. Do you have a problem like health asthma, tuberculosis, diabetic, heart disease, or anything allergic with food or animal or some stuff, ma'am?
Oh, no, I don't have.
Okay. So now let me check about your physical examination before we get talk about your health in pregnancy. Okay, ma'am?
Yeah, okay, ma'am.
All right. Let me check your vital signs, Miss Dea. I will check your blood pressure, temperature, and respiration rate, sir, and your pulse. Okay. First of all, roll your sleeve up, please. I will measure your blood pressure. You can
Alright,
roll it.
like this.
Yes, that's right. Well, I will measure the blood pressure, and the result of your blood pressure is 120 per 80 mmHg. You have normal blood pressure. So further, please put this thermometer on your armpit. Wait for some minutes, okay?
Oh, alright.
Okay, okay, it's finished. So we'll see the result. And the result is 37 degrees. Now let me have yours, please. I will check your pulse. Okay. So the result is your pulse is 80 per minute, ma'am. And now
Okay.
please stand on this scale. I will check your weight, okay, ma'am?
Mm-hmm.
Okay. So it's around 55 kg, ma'am. Okay,
Mm-hmm.
I will note about it. So now you have sit down, please.
Okay, okay. Thank you, ma'am. Okay, thank you, ma'am.
Okay.
So, how many times I should have checked my pregnancy?
Okay, so for the examination in pregnancy, at least 4 times during pregnancy, ma'am. First time or 1 time at gestation age before month, and then 1 time you should have to check it on 4 until 6 months gestation, and you should have to twice check about your examination on this pregnancy around 7 until 9 months gestation, ma'am.
Oh, yeah. What to avoid of during the pregnancy, ma'am?
On the pregnancy, during pregnancy, you should have to not work so hard, smoke or exposure to cigarette smoke, drinking alcohol and drinking herbs, taking drugs without a doctor prescription, and excessive stress, ma'am.
Okay, Miss Ziyan.
Okay, so if you have any of the following signs of cure, should be taken immediately to the hospital or health center, like are feels ill, swelling of finger, face, legs, or your hand, vaginal bleeding, confusion, severe headache with blurred vision, fever, and too weak to get out of bed, severe abdominal pain, and fast or difficult breathing, you should have to come to the hospital or you should have to call the midwife. So you should have to more examine the pregnancy and the pregnancy test and
Well, thank you, Midwife Ziyan, for your information. That's very helpful for me.
you're welcome. I hope Miss Dea is always good during your pregnancy and don't forget to keep eating a little bit often, okay, ma'am?
I mean, okay, ma'am, I will note it and keep my nutrition for this first trimester of pregnancy.
Okay, I'm glad to hear that you have really such a nice person and to know about this information very good. So I will give you some supplement and vitamin to reduce the vomit or the nausea and giving a lot of nutrition for your baby to grow and development in this first trimester. Okay, ma'am?
Oh, okay, ma'am.
Okay, ma'am. So this is the supplement and vitamin that you should have consumption in this first trimester for the next 30 days. Okay. So the first one, you have vitamin B6 for reduce your nausea symptoms. You have to take them in one per day and swallow it with water of glass. And then here you have folic acid, one per day. And then you have iron, one per day. And then vitamin B12, one per day. And vitamin C, two per day in the morning and the afternoon. This vitamin, you can swallow it with water of glass. And I have suggest you to reduce of tea and coffee on this pregnancy because it could inhibit this good nutrition to be absorbed by the body. Okay, ma'am?
Okay, ma'am. That's a lot of vitamin that should have and consume it per day. I will make a reminder with my husband and make a note on my phone to remind me take this all supplements.
Okay, ma'am. So pregnancy always needs partners, okay, ma'am? And a good cooperation from parents can provide a healthy pregnancy and better fetal development. I hope you and your husband can carry out this pregnancy process in healthy and fun process.
I mean, thank you for this good motivation, ma'am.
Okay, ma'am. So, did you have a question about this pregnancy or something that you want to know on this first trimester of pregnancy?
I think it's enough, ma'am.
Okay, so I will give you this book for you. So it will remind you about the schedule, and I will make a schedule for you in the next week on the 1st March 2021. Okay, ma'am. You should have to do laboratory tests to find out your health in this pregnancy, mainly to detect the presence or absence of complication in your pregnancy. Would you have to come to this test, ma'am?
Oh, okay, ma'am. I will attend the schedule, inshallah.
Okay, ma'am. So for the re-examination of your pregnancy schedule will be scheduled on the date of 20 March 2021.
Yeah.
But if you have experienced complaints such as those in this book, like bleeding, nausea, and vomiting too often, to not want to eat, discharge from the vagina, smells, itches, or colors such as greenish, high fever above 38 degrees Celsius, you should immediately come to clinic to get ongoing examination and monitoring to understand about the problem. Okay, ma'am?
Oh, okay, ma'am. I will take care of my health and monitor my baby development during this pregnancy, ma'am.
Okay, ma'am. So I hope this pregnancy will always be healthy and good for the mommy and the baby, okay?
Okay, ma'am. Thank you for your help and this lot of information. See you in the next. Yeah, ma'am.
Okay, yes. See you soon in the next reunion. Stay healthy.